Welcome to Physician Heal Thyself, the podcast, empowering you to take a whole person approach to your well-being, spirit, soul, and body. Join me, your host, Dr. Ana Lara, naturopathic doctor, entrepreneur, and a servant of Jesus Christ. We are not just a body, we are spirit and soul. It's time to integrate medicine and spirituality into our healing. Let's get started. Welcome back to Physician Heal Thyself, the podcast. I'm your host, Dr. Ana Lara. This episode we're going to dedicate to Cancer Awareness Month. And so I'm going to share with you some things, daily things that you should be doing to prevent cancer. So I know that some of you who are watching this have either been personally impacted by cancer or have a family, a loved one who has had cancer or even passed away from cancer. So I started working with cancer patients almost 5 years ago. It wasn't something that I initially saw myself doing. But, that's just the way life goes. I started really getting into helping patients who did have cancer. And I'll tell you, it's always great when someone overcomes cancer, but it's very devastating when you do lose a loved one because of cancer. It is so taxing on the individual who has the cancer themselves, but also on the family, not just financially, but emotionally and just physically. It's a lot. So one of the things that I've always thought is how can we prevent people from developing cancer, or how can we screen earlier on when, to see if someone does have cancer and start treating people at an earlier stage versus when they're in stages 3 and 4. So this episode was actually a great idea by one of my patients who said, I want to learn more on what we can do every day to prevent cancer. And I thought that was a great idea from this young man to start thinking that way. And I pray that more young people will listen to this and start implementing this, because I see young people going down a path of disease very, very early on. So one of the things that I want to talk to you about today is something that's in naturopathic medicine. We call it the therapeutic order. And so this naturopathic therapeutic order is how we address an individual when it comes to dealing with disease. Now, I have a great mentor who we've been talking a lot about, diseases and so forth. And he started talking about how sometimes we normalize, medical conditions. And what I mean by that is that we take something like cancer that is a process. It's a biological process. So there's an action there, something that happened that allowed cancer to develop. So we take something it's a verb, and we make it into a noun, meaning we make this condition almost like it's a person. So people will say, my cancer, or my fight against cancer, like you're fighting a person, we see a lot of that FU cancer, like it's a person. We treat cancer like it's a person, and it's not a person. There's various biological things, physiological things that have occurred that have gotten to this point that the body developed cancer. Cancer is not a person. We should not refer to any illness as it is a person. So we have to look at, how did we get to this point? How did we get to this point? Because the body gives us signs and there's symptoms that develop to say, they're signaling saying there's something wrong here. Unfortunately, a lot of our problem is that we are too busy to take notice of what's going on in our physical body. We're too busy, and we ignore the signs. We ignore the symptoms. We suppress them. We keep pushing through the pain. We keep pushing through that little sign that you're getting, and that sign becomes greater, bigger, louder. And then when people do go in to see a doctor, because there's something off, it's very advanced now, and so they're cancers are usually in stages 3 and 4 when they are, screened for and checked on. And so there are some cancers that, they have certain preventative early screening guidelines for them, colon cancer, breast cancers. But there's a lot of cancers that they do not have a screening process for preventative purposes. So we're going to talk a lot of these great, amazing topics that should bring you some education and awareness. And as always, this information is not for me to treat you. I don't know your individual health and lifestyle. Only your doctor knows. You have to establish a relationship with a doctor for them to know these things. So this is really for strictly educational purposes so that you are aware of what you can be doing today to prevent some of this cancer or start screening early. So we're going to talk about the therapeutic order. Like I said, it's a naturopathic therapeutic order. There are 7 steps. So the first step is identify and remove causes of disease. And this also includes for preventable diseases. Second is establish a healthy regimen. 3, stimulate the self-healing mechanisms. 4, support weakened and damaged systems. 5, correct structural integrity. That means making sure your spine and everything else is in alignment. 6, address pathology. And 7 is suppress pathology. So we start with the least invasive, right? And we work our way into this order. So the very first thing that I recommend is that you find a doctor that will run a comprehensive blood test. That's going to go outside of the conventional medical model. And here's why. It's a very good idea to get a good baseline of where you're at health-wise in regards to your hormones, inflammatory markers, screening for autoimmune conditions, screening for diabetes, insulin resistance. And there's also biomarker tests that you can screen for early stages of cancer. And we're going to talk about that later on in the episode on a particular company that I use for these biomarkers to screen for cancer. You also want to do a screen for heavy metals, environmental toxins. And then this is a questionnaire to see has the person had exposures. I'm going to tell you right now, we've all had exposures. In anyone living on this earth, we've been exposed to heavy metals and environmental toxins. It's very difficult to avoid being exposed to them. However, how we determine if it's a necessity to check these heavy metals and environmental toxins is if someone is having potential symptoms of it. But it doesn't mean that if you're not having symptoms, that you can't get checked. Remember, these labs are not covered by insurance. Most of the time, people are paying cash for them, which actually makes it better because that puts you in the driver's seat of your health. You make the decision to do these tests, and then you know right now, today, where you stand in terms of exposure to environmental toxins and how much of those environmental toxins are a toxic burden to your physical body right now. And so these can include the BPAs, herbicides, mitochondria markers, parabens, pesticides, phthalates, any volatile organic compound, mycotoxins. So mold exposure is something that I see a lot in people. Organic acids, oxidative stress profiles. So there's a lot of tests that you can do that will let you know where you're at health-wise, so that if you minimize these things and improve your health, that you can, reduce your risk of cancer. So I'm going to talk again about something I've talked early on when I put this podcast out. And if you go back to episode 2, I talk about the 4 pillars of health. Episode 3 talks about nutrition. And episode 4 is on exercise. Episode 5 is on sleep and stress management. I'll put those in the description of this episode as well. But these episodes of the podcast talk about the importance of those key things about nutrition. I'm not going to talk about nutrition as it relates to cancer because I've done so much on other episodes that talk about the importance of, cut the shit out of your diet, basically. It's what it comes down to. Just cut out the junk and add the good, real food. And that's really bottom line. That's what you need to be doing. A lot of people have questions about organic food versus non-organic food. And I'll recommend that you look at the Dirty Dozen. Avoid eating the Dirty Dozen. These are the foods that are highest in pesticides. I'll put links on where you can find those as well in the description. You also, there's a clean 15. So these are the 15 foods that are clean that you don't have to buy organic. And so the Dirty Dozen, you want to consider buying those organic, or grow food in your own yard and have a little garden for yourself, especially those foods that are highly sprayed, that have pesticides in them. So those 4 pillars of health are very important in the prevention of cancer as well. Now, some other things that I want to include besides those 4 pillars, in addition to that, is something that's not very sciencey, but we have seen more doctors and scientists research this, and it's on healthy relationships, having healthy relationships, making sure you're taking care of your emotional health, and forgiveness. I have worked with patients who've had cancer, and while doing these IV infusions with them, I'll sit with them and I'm having conversations, and they start sharing things about their life and things that led up to this point. And what I find is that oftentimes there's a lot of unforgiveness there. There's a lot of resent. There's a lot of emotional baggage that's never been expressed. There's been unhealthy relationships. And so remember that cancer is a process. It's a biological process that got here. But if how you feel emotionally is not aligning with what is true to you, and you're not being nourished on the emotional, spiritual level, people start to constantly be in fight or flight mode, and you're stressing all the time. And if you're in a relationship that's not healthy for you and is just not aligning, regardless of the work and effort, sometimes you do have to make very difficult decisions and close certain doors to some relationships for the sake of your health, literally. I've had women, young women, in their early 30s, have uterine cancer. And there was a lot of unforgiveness there because of, the toxic relationship they had with their spouse. So instead of trying to work the issue out or getting counseling or even leaving the marriage, they forced themselves to stay. And their body, regardless of how healthy they were eating, this woman was eating healthy, exercising, taking all these natural things, was just taking good care of her body, but then just developed this cancer. And unfortunately, it did take her life. This woman on her deathbed shared with me all the things that, she had experienced. And she was still questioning on her deathbed, how did she get here? And as she started to talk to me about her story, I sensed there was unforgiveness there. And so I walked her through forgiving others, forgiving the people who intentionally hurt her, and forgiving herself, for not having made different decisions. So unfortunately, these things do correlate with developing cancer. And so, like I said, cancer is not a person. It's a process that has allowed itself to come to this point. All right, so let's move past the emotional stuff here. But it is a very important part of, of helping someone. Preventing cancer is the conversation we're having. But if you have unforgiveness, maybe it's time for you to really lean in and start forgiving people for your own good, literally for your own good. The next step I want to make sure we talk about in this conversation, it's cleaning up your life, your environment from chemicals. It is everywhere I go. Everyone has their perfumes, toxic perfumes. There is no such thing as a healthy perfume. These fragrances, these perfumes have so many things that affect us, and people don't think twice about it. They don't think it hurts us. They think because they're not ingesting it or it's not topical on their skin. You got to understand, anything that you inhale, it goes in through your lungs, and these things enter our bloodstream. So whether you're inhaling the fragrance, the chemicals, whether it's topical on your skin, you're ingesting it, there's exposure to these chemicals. So I immediately start telling my patients, let's start removing fragrances. So what fragrances are you exposed to daily? perfumes, lotions that are fully scented, shampoos, conditioners, makeup, laundry soap, fabric softeners of any kind, whether it's fabric sheets or fabric softener. There's a lot of chemicals in there that are cancer causing. Any home scent diffusers, unless it's essential oils, those are fine. Any aerosol sprays, like what is the Lysol, things like that. Like you're using these things a lot. Some of these have chemicals that are cancer causing, but some of these toxins, what it does, if it doesn't cause cancer, it causes a toxic burden on your body, on the major organs that help you to detoxify. And we're going to talk about those organs. But you want to make sure you minimize your exposure to chemicals in your home, what you're using on your personal self, what you're ingesting, and then what are the fragrances, because these are hormone disrupting and cancer causing chemicals most of the time. So the cleaning products that you're using around your house, detergents, just personal hygiene. Now, if the kind of work that you do is risky and it exposes you to certain chemicals, like I have patients who paint. They paint houses. That's their profession. They're painters, and they're constantly exposed to the smells. And I tell them, you got to make sure that you have the right gear. It's going to minimize at least some of the exposure you're having. And then what we do is consider doing more frequent detoxes, and I'm going to talk about that as well. Certain detoxes that are going to help the body, just to help the liver and kidney to be optimally functioning all the time. So I'm going to provide you a page, a great website of the Environmental Working Group. EWG.org is their website. This is an amazing website that you can go to. You can pretty much put any product that you have at home, and it will tell you everything that's in there and the effects it has on your body. Now, on the flip side, because we don't want to depress you and overwhelm you by going to the site or even by this conversation, it will also reference you to clean products that you can use to clean your home, to use on personal hygiene. So that's the Environmental Working Group, EWG.org, a great website to reference to. So just to kind of go through, there's a lot of known human carcinogens. A carcinogen is a chemical, a compound that has been shown to prove cancer. And the ones that we know for sure, there's 4 of them that for sure they're known to cause cancer. Arsenic is one of them. It's found in soil and rock, but it can be found in contaminated water and also in some food sources. So some seafood, rice, certain mushrooms might have higher levels of arsenic. Brown rice seems to contain higher levels of it. So, how much rice you eat, maybe you want to soak it, but arsenic is definitely one that's been high. And these are compounds that you can test on these environmental toxins to see where you're at. Like I said, all of us have some exposure to these environmental toxins, but how much we have in our body is what determines what's healthy, what's not. So just so you know, these tests that we do or that I do on patients, they'll have a green, yellow, and red zone. So it'll let us know you're in the green, you have some exposure, but it's not dangerous. If it's in the yellow, it's present, but we want to still do something about it. And if it's in the red, then we know for sure it's high levels, and we need to make sure that we start detoxing you to bring it down so you don't develop health issues. The second human carcinogen that we know is benzene. This is found in gasoline, petroleum products, tobacco, smoke, not just the tobacco, but the tobacco smoke in itself. Vehicle exhaust, industrial emissions, volcanoes and forest fires. So if you live in an area where there's volcanoes that do erupt or have been through experienced fires, these things they're released in the air. And so if you inhale these, it can put you at risk for cancer, especially the lung cancer. So you want to get checked out for these. Beryllium is another one. It's found in a lot of aerospace, aircraft, electrical heat conduction type of things. And vinyl chloride. Vinyl chloride is used to make PVC, so any hard plastics pipes. wire coatings, packaging material. So we're going to get exposure of these somehow or another, even if it's minimal. As long as it's minimal, it's okay. But if it's high levels, then we want to definitely do something. There's other things that we know are possible carcinogens. Chloroform, it's in a lot of industrial processing, production, coolants, dry cleaning, spot removers, pesticides, dyes, they're plasticizers. DDT, it's a toxic pesticide. And then we have the polychlorinated biphenyls, PCBs. These are found in paints, adhesives, any caulking compounds, printing, inks, fire retardants, which is in our beds and many other things that we buy, right? So those are just some of the common chemicals. But some of the top chemicals that can increase people to have a high risk, are also alcohol and tobacco use. I remember sitting through the thousands of hours of medical school for all the different pathology type of courses, including oncology courses. And on every medical condition, the risk factor for all conditions, alcohol and tobacco use was always on all of the lists. It didn't matter if it was diabetes or this cancer or that cancer or whatever condition. It's like at the end of medical school, like if you're drinking alcohol or using tobacco, something's really wrong with you. Like we should be educating people to not consume these, And alcohol, it's obviously if you're using high levels of alcohol, if you're having a small glass of wine, that's not going to increase your risk substantially. But if you ask a good neurologist, they will tell you to stay away from alcohol because it's not good for your brain. So that's my take. Asbestos, excessive UV rays, right? So if you're just exposing yourself to the sun at ridiculous amounts of time without any protection, that's going to expose you to high risk, especially of skin cancer. Insecticides, flame retardants, formaldehydes, those are all things that are top chemicals that will put you at risk for cancer. So just be conscious of what you're putting on your body, inside and outside, and what you're smelling. My biggest pet peeve, and people who know me know this about me, I hate, and I don't use the word hate too often, but I hate going to the gym and everyone is just doused over in tons of perfume and cologne. Like this is the worst time to be using perfume and cologne. You might not think so. You might want to smell pretty. But what is the number one thing that people in the gym are doing? They're moving their body and they're breathing more often than if they were not exercising. So they're breathing in more and they're inhaling these perfumes and colognes. Even if it's not me wearing it, I'm smelling it from everyone else. I'm inhaling that. And, not just is it only a problem for you cancer-wise, but neurologically, it's just these fumes, they should not be there. So you want to be conscious of what you're putting in your body. I know you want to smell good. I want you to smell good. I don't want to be next to someone who's stinky, but be conscious of the products that you're using. There's products out there that are more natural and safe for you to do. All right, we're going to move on to what do we do to screen preventatively? Now, there are some things, to get your colonoscopy at age 50, get your mammogram. Mammograms are now done at 40. People used to wait till they're 50 years old to do mammograms. But, now they're moving the age, and I think they're moving the age earlier, because there's younger people that are developing cancer. And this, to me, I know that a lot of it has to do with the environmental toxins and exposures, chemicals that are injected into our body, that are put on our body, that we ingest, whatever it is, these chemicals are causing a disruption in our hormones and are causing cancer. So one of the things that I tell people, if you know that there's a particular type of cancer that runs in your family, be proactive. Don't wait till there's signs and symptoms of it. Be proactive. Do all the lifestyle modifications. But in terms of screening, age is probably the greatest risk factor for cancer. As we get older, we have a higher risk for it, which is why many adults over the age of 50 will start to do screening for cancer. So over the age of 50, it makes us 13, oh, not us, because I'm not 50 yet, hold on. But over the age of 50, it makes people 13 times more likely to have cancer compared to people under the age of 50. So 13 times more. You should definitely be looking at ways to screen for it. Now, certain factors that, in addition to age 50, that further increase cancer risk is people with diabetes, obesity with the BMI over 30. And if you currently smoke or previously smoked in your life, those will increase your risk of developing cancer more. However, like I said, I am seeing younger people. We hear more about younger people developing cancer. And I personally have seen this in my clinic, seen 20-year-olds with colon cancer or other cancers that are just we're not used to seeing that. So what might be some of these contributing factors? You might ask, what's causing younger people or more people to have more cancer? And I really think that the number one thing is these environmental toxin exposures that we have more of now than 100 years ago. I think that also the poor diets, not having the right nutrition, is affecting the way the body is functioning. And so also poor sleep patterns. Young people are not sleeping enough. So the body's not taking the time to regenerate and recover and heal at night when they're sleeping. And also higher levels of stress. It's going to compromise the way your immune system functions. So you want to be considerate of those things. We're never going to step away from the four pillars of health. And that's the nutrition, exercise, sleep, and stress management. But in this one, we're going to add environmental toxins that you're exposed to. You want to minimize those. So earlier I talked about some testing that, in addition to help with preventive. So this is advanced biomarker testing. And I do this through a company called Galleri. Galleri it's a simple blood test, and it screens for 50 or more types of cancers. So the cancers, that the way the test works is that cancers grow in the body, right? They shed a DNA and into the bloodstream. And so it's through this DNA that the test is able to pick up these DNA fragments. And it's like a fingerprint to that particular cancer. And these DNA fragments lets us know where it's coming from. Is it coming from the thyroid? Is it coming from the ovary? Is it coming from the lung? Is it coming from the skin? So these DNA fragments that are tested in the blood will let us know if they're high levels, where they're coming from. And that test will then allow me as a practitioner to say, okay, there's thyroid cells that are showing thyroid carcinoma. Let's go do further testing or imaging to assess and to confirm if that is a cancer that's in this area. Then we can start treating. The unique thing about these biomarker tests that Galleri does is that it catches some of the deadliest cancers before you have symptoms. So what that means is that we're catching these cancers as stages 1 and 2. And I'm going to talk about what those stages mean here in a minute, but it's early on we're able to screen, and if those markers come elevated, it's early on, meaning it's not advanced, which means it makes it easier to treat and reverse that, and that person have less, complications. They have a better outcome if we catch it early on. So this is true, by the way. Oftentimes, cancer that's in stages, like in the early stages, sometimes there's no symptoms. So there's no way the person knows if they have cancer in them until they do a test like this. I think this is a great test that can help to assess a person. If there's risk factors there, they can do them every year or every other year, depending on how the person feels. Now, unfortunately, these tests are not covered through insurance, but you know what? I think if you have a family history of a particular cancer, or you're concerned, you are concerned that you may have a cancer, this is a great tool to do once a year or every other year, and not be taken by surprise when it does show up, because it'll pick up. It's sensitive enough that it picks up these DNA fragments early on when the cancer is developing and there are no signs. So I want to talk about these stages of cancer that I mentioned. So the stages of cancer is typically it's staged from a scale of 0 to 4. And the higher numbers are indicating larger, tumor and more of a spread. So stage 0, there's abnormal cells that are present, but they have not spread to nearby tissue. So sometimes this is known as a carcinoma in situ, so CIS. And it's not considered cancer, but it can become cancer. So usually what happens is doctors will just monitor this to make sure it doesn't develop into cancer later. My brain as a naturopathic doctor, and the way I'm trained and the way I believe is, I'm not going to wait for it to become cancer. This person, I'm going to go through diet, lifestyle. Let's change this. Let's do these other tests to make sure that that's not a contributing factor, because I want to help the person reverse these abnormal cells as soon as possible today. So I'm not going to wait. And in conventional medicine, they wait to see if it becomes cancer later. I don't believe in wasting time. So stage 1 is going to be, there is a tumor, it's small, and it's contained in one area. So once again, sometimes in this stage, if it's a tumor and they're able to remove it, they may remove it. They may do some radiation. They may just observe to see what happens. So I don't believe in waiting. Just know that. Stage 2, the tumor has grown larger and it's possibly spread to nearby lymph nodes. So it's larger and it's possibly spread to lymph nodes. It's not confirmed. They would have to do biopsies. They can do a biopsy of the nearby lymph nodes to see, or distal lymph nodes to see if there's any spread, if there's of that DNA fragments being there from the tumor. Stage 3, the tumor has grown deeper into the surrounding tissue and has potentially spread to nearby lymph nodes. Usually stage 3, most likely it has spread to lymph nodes. And stage 4, the cancer has spread to distant areas of the body through the blood and lymphatic system, and this is also known as metastatic cancer. So that cancer that started in that one area now has gotten bigger and bigger and has spread to other parts of the body, and oftentimes it's multiple places. So some cancers have an affinity to metastasize, to spread, right, to the liver, to the lungs, to another organ, to other tissues. And the more that cancer spreads, it is harder to contain. And so this is when people are blasted with chemo or radiation, sometimes surgery, they're able to remove it. And I'll tell you, I've talked in previous episodes about doing ozone with ultraviolet light, and or EBU, which is higher levels of ozone and ultraviolet light. And these help to treat any of these cancers from stage 0 to stage 4. But I always say, depending on how advanced that stage 4 is, then, it's not a guarantee. But if we can treat people early on, they have a better outcome of reversing cancer. Now, I did have a patient. He was stage 4 testicular cancer, metastasized to organs, kidneys, other areas. And this person was very dedicated, did the diet, everything I told him to do, he did it. That's pretty much it. All the herbs, the diet, exercising, everything he did. We did 3 IVs a week of IV ozone and with ultraviolet light. And every 3 months we did ultrasounds, CAT scans, CT scans to see where he was at in blood work. And immediately these tumors were shrinking, guys. These tumors were shrinking. The blood work was showing normal. There was no tumor cells there. The inflammatory markers were down. And then the tumors just kept shrinking. About a year or so after initially starting treatment, every single tumor was gone. So that was probably one of the most advanced and difficult cases. But these things can be reversed, and I would prefer people start early on screening for it. So I want to start wrapping up here. I'm going to provide you guys with several resources to turn to, and I just want to review once again that therapeutic order. We identify and remove the causes of disease. So meaning we got to identify by blood work where you're at health-wise. and what are the risks that can contribute to developing cancer, right, for this particular topic that we're having. Removing the causes of disease, those environmental chemicals exposures, the poor diet, those are going to be big things that you start removing the things that are causing imbalance in your body. A cancer cell does not start from one day to the next. It is a process that happens daily. So the decisions that you make daily are going to impact the risk factors of cancer, regardless of what your genetic makeup is. Start establishing a healthy regimen. Create a healthy diet, start planning, start exercising, even if it's 20, 30 minutes a day. It does not have to be 2 hours at the gym. Start developing healthy relationships in your life. If there's unforgiveness, let it go. Really pray in to allow yourself to work through forgiveness and align with relationships that really, align with who you are, that resonate with who you are. So start creating those healthy regimens of sleep, exercise, nutrition, stress management, and then stimulating the health healing mechanisms. This is where I talk about, aside from the diet and the herbs, is, help your body to detoxify. Exercising helps you to detoxify. You're sweating, there's blood and lymph that's moving, you're sweating, you're pushing toxins out. That's a really good thing. But consider doing a detox at least twice a year, every 6 months. Our livers do so much for us. And if we are adding things to our body that adds more of a burden to it, it's going to be very difficult for these organs, these detox organs to work. And so some of the detox organs that I want you to know about are, our liver, our kidneys, our colon pushes toxins out, our skin, our lungs. When we exhale, we're pushing toxins out. So there's different types of detoxes out there, and I'll do another conversation on detox because there's a lot of things over the counter, but there's medical grade herbal detoxes that I like to put my patients on to get a really good thorough cleanse at least every 6 months. Someone who does work in a job where they're constantly exposed to chemicals, I would say every 3 months you should do a detox because of your exposure to it, unless you change your job. That's the only way around that. So support the weakened and damaged systems. And the only way you know if a system is weakened or damaged is to do the blood work, to know which organ or what's going on in your body that's imbalanced. So if you're deficient in vitamin D, guess what? You want to have good levels of vitamin D, because vitamin D is also cancer protective. And there's a lot of vitamins, a lot of nutrients, a lot of things in our bodies that are helping us to prevent cancer. So antioxidants that help clean out our cells from, damage. You want to find out what those systems are, which systems are weakened or damaged. Why? So the next one's correct the structural integrity. Why is it important to have proper alignment? Well, our brain and the spinal cord are all part of this structure. And if there's a kink anywhere in that structure, it's not going to send the right information to the organ to function optimal. So that's why getting a good adjustment by a good chiropractor is a good thing to do, at least a couple times a month, at least once a month. Addressing pathology and suppressing pathology, that's when there's actual illness. So this conversation is preventing cancer, not to treat cancer. So we hope to not have to address and suppress symptom or pathology at this point if you're doing the other 5. So as we wrap here up, find a doctor, someone who's going to really is willing to do a full health assessment of where you're at, and be willing to invest also. I think that's where a lot of people are hung up. Does my insurance cover this? Well, no, but if you were to find that there's some things that are out of balance and could lead to cancer, wouldn't you want to know that now instead of in 10 years or 5 years? And then, you really need to have insurance to cover chemotherapy and all the numerous visits and invasive treatments that you'll need. So sometimes we need to invest upfront on our health. And so make sure you're avoiding those toxins. And like I said, do a quality detox every 6 months minimum. And by avoiding those heavy, toxins that burden the liver, the kidneys, the lungs, the colon, the skin, you have a much better outcome in health. So Hey, I know we talked a lot about this information. I'm going to be posting a lot of links on here for you guys to reference to. But if you have any questions about seriously working on the preventative side of preventing cancer, reach out, go to my website at raisesndmedcenter.com and schedule a free 15-minute phone consultation and learn how, there's some ways that you may be able to prevent cancer for yourself. So in honor of Cancer Awareness Month, I wanted to bring this episode to you as education and some things that you can take away to start implementing today. So until next time, be blessed. Thank you for listening to Physician Heal Thyself, the podcast. If you like what you've heard, please like, share, and subscribe. Help this message reach more people who may need to hear it. Leave your comments. I want to know what you think. If you're interested in learning more about Raices, visit our website at raisesndmedcenter.com. Until next time, be blessed.